So choosing your Medicare program can be a very daunting task because there's so many options available out there for you. But the very first step is going to be to enroll in Original Medicare, Medicare A and B, and you enroll through the Social Security Administration. Now, Medicare A for most people is free, but Medicare Part B does have a cost. And you would be required to pay that cost for Medicare Part B to Social Security, regardless of if you end up enrolling in a Medicare Advantage or a Medicare Supplement plan. So the next choice is going to be, do you want Medicare Advantage, Medicare Part C, or do you want Medicare Supplement, otherwise known as Medigap insurance? And then, of course, the prescription drug coverage as well. Now, all of these plans are sold through private insurance companies, and HTA can help you select your best carrier, your best plan, and help you enroll in the program. Now, Medicare Advantage is advertised as an all-in-one plan alternative to Original Medicare. Now, don't be confused. You still have to pay that Medicare Part B premium to the federal government, but this kind of takes the place of that. You have one ID card, and it covers your medical insurance, prescription, potentially dental, vision, gym memberships, and some other services. Whereas Medicare Supplement is more of an a la carte program. You're still going to use your Medicare A and B card. You're also going to have your Medicare Supplement to supplement that medical care. And then you can purchase separately if you're interested, the prescription, dental, and vision coverage. So really, what plan is most appropriate for you is going to depend on your own preferences. So look at these questions, see how you feel about each one, see which preferences are more important than others to you. And if you have a strong feeling on one or two of the questions, those should be the ones that we're focused on when deciding what type of program is most appropriate in your situation. So how important are ancillary benefits to you, such as dental, vision, gym memberships, things like that? Do you prefer to have a lower premium, the money you pay to the insurance company to access the care? Or do you prefer to have lower out-of-pocket costs when you actually receive medical care, pay less at the doctor and the hospital? How many medical providers do you see? Do you get a lot of medical care? Are you going to the doctor frequently? Are you getting a lot of tests run every year? Do you intend to move or travel after retirement? Will you be staying in the same spot, or do you need health care that's going to move with you throughout the United States? Would you be willing to change your provider if your provider is not in the network, or if your provider leaves the network mid-year? And lastly, how do you feel about managed care? Managed care are things like insurance company oversight on your medical care, permission to access certain services, which is called prior authorizations, or potentially limits on the types of services that can be received for certain situations. So thinking about all of those, ranking them on which one of these concerns is most important to you, and talking through that with your advisor will help you come to the conclusion as to what type of insurance may work best for you. So let's compare the benefits. Starting off with the supplemental benefits, things like dental, vision, hearing aids, gym memberships, Meals on Wheels programs, over-the-counter medication benefits. Many of these benefits may be included in your Medicare Advantage plans. Medicare Advantage plans include some or all of these benefits. I would encourage you to look over the plan. If any of these are important to you, bring it up so we can make sure that we're looking at a plan that has these benefits in place for you and has pretty decent payouts on them. Versus a Medicare Supplement. Now, you can get these benefits. You can get dental and vision and hearing, but you would purchase it as a separate insurance policy. It's not included in the Medicare Supplement. Gym memberships. Some of the plans do have gym memberships as a value-added benefit. There's only a couple companies out there that do that. So if that's important to you, let us know. If you're leaning towards a Medicare Supplement, but you want the gym membership, there's a couple carriers that might be more appropriate for that. When it comes to premium versus benefit cost or healthcare cost, Medicare Advantage is going to have a lower premium. In fact, many of them are advertised with a $0 premium. So you don't pay anything for these plans, and they include prescription benefits, so you don't have to buy a prescription program either. So very low premiums in most cases. But when you receive medical care, you're going to have copays for all of your services. So your copays will not max out until you reach about $8,300 per year in in-network out-of-pocket expenses on many of the plans. So if you're generally healthy and you're not getting a lot of medical care, you can certainly save money on the premiums here. But on the Medicare Supplement side, it's the opposite of that. So you're going to pay more in the premiums, but lower for the medical care. So premiums for Medicare supplements tend to range from about $100 to $250 a month. It's going to depend on your age, your gender, and your zip code. You purchase your prescription drug plans separately. So the good news is you can choose the most appropriate prescription plan for your prescription needs. The bad news is there's a premium for that of anywhere from, I don't know, $10 to $50 a month typically. So adding a little bit more to those premiums. But when you receive medical care, very little to no out-of-pocket expenses. The most popular Medicare supplement plan has an out-of-pocket maximum of under $300 a year. So if you say, I'm okay paying the insurance company more money, but I don't want to pay anything for my medical care, Medicare supplement may be more appropriate. If you say, I really want to save money on my premiums because I don't tend to get that much medical care, Medicare Advantage may be a consideration. Let's talk about how you access your care. So Medicare Advantage is going to be a bit more restrictive than Medicare Supplement on this. Medicare Advantage plans are managed care programs, meaning you could have prior authorizations for certain services. There could be limits on some of the services that you would like to get or need to get for your condition. There's networks involved, PPOs, HMOs, private fee-for-service. Your networks tend to be regionally based. Medicare supplements, there's a little bit more flexibility there. There's no managed care, meaning you and your doctor make your decisions on your medical care, and there's no network. You can go to any doctor that accepts Medicare nationwide, and in 2020, a study was done that was 99% of all non-pediatric doctors accept Medicare. So the one question that we often get asked is, well, how can I switch between the two? I want to start off now with the lower premium plans because I'm not receiving an awful lot of medical care. But if I need more medical care, I may want to go over to the plan that has the higher premium, but the lower out of pocket for medical care later. And there's only certain times that you can enroll in these plans. So Medicare Advantage, you can enroll when you're first eligible with no medical questions, and you can enroll once a year, every year, with no medical questions. So you can either enter a Medicare Advantage plan or you can switch between your Medicare Advantage plans once a year for a January 1st start date. That enrollment time is October 15th to December 7th. Versus a Medicare supplement, initially that first eligible, you can go in with no medical questions. But after you've been in Medicare for a minimum of 6 months, if you want to go into a Medicare supplement plan later, or you want to switch your Medicare supplement plan later, there would be medical questions to determine if you're eligible to change at that time. So it's easy to go from Medicare supplement to Advantage because you can do that every year. It's going to be a little bit more difficult to go from Medicare Advantage to Medicare supplement if something happens to your health at a later date. So let's review the pros and the cons of each program. So Medicare Advantage plans, the pros are going to be that low monthly premium. You have additional benefits in many cases of dental, vision, gym memberships, things along those lines. It's an all-in-one plan, so you're only going to have one ID card to carry in your wallet. There's many plan options available, and you can change and shop those plans each year without medical questions. Now, the cons are going to be in the medical costs, the medical care. The maximum out of pocket on Medicare Advantage plans is higher at up to $8,300 in network per year. There's doctor network restrictions, and these networks may be regionally based, and so it could be a little bit harder to travel and find those doctors that you need. Managed care, the insurance company works with you and your doctor to make those medical decisions. And also, if you wanted to switch from Medicare Advantage to Medicare Supplement later, you have to be healthy enough to do so because there will be medical underwriting. Now, on the Medicare Supplement side, the pros are going to be the low out-of-pocket cost. You don't pay very much at all for your medical care under these plans. There's no doctor network restrictions. You can see pretty much any doctor nationwide. No managed care. You and your doctor make all your medical decisions. Some of the plans even have some limited benefits for foreign travel emergency, and the plans are standardized, so they're really easy to understand. Now, the cons on the supplement side, a lot of them have to do with the premium. You're going to pay a higher monthly premium for these type plans, and if you want dental, vision, or drug benefits, you're going to buy them separately, just adding to the premium. And these plans can have annual rate increases. So you're going to pay more for the Medicare supplement plans to have them, but you will have that lower out-of-pocket expense and the more flexibility. Another downside of Medicare supplements is the multiple ID cards. So you will be carrying a Medicare card, a supplement card, a prescription card, and potentially a dental vision card in your wallet if you do the Medicare supplement route. So there's really no way of saying what type of plan is better for you. It's really what are your objectives and what's most important to you with your medical care and your premium budget. Please give us a call. We'd love to talk to you about it and walk you through the individual options with the carriers and what they cost. You see our website at the bottom of the page as well as our phone number. So we'd love to hear from you and help you with this important choice.